Ashish. Welcome
Hello.
to Chrome Talkies.
Thank you so
And so Ashish, young person like you, it's really fun to kind of see people. Good to see people like you, here around yourself. We old people can probably learn a lot more from you, your energies. So a little bit about yourself, Ashish.
So, I am a group and product,
Wow. Everybody
media
else,
masters,
mostly people that I mean, they are. Institution.
media
I
masters,
also, by the way, began life in St. Thompson's, which was like a pre-group.
pre-group empire.
Yeah.
Absolutely, yes. And I think I owe a lot of what I am doing right now in terms of those people that I worked with. So if I have to first talk about myself, I think the entire credit goes to them in terms of keeping my energy high, in terms of keeping your mind right, in terms of making you learn more. So all of those habits came from those people that I worked with, and my first job. You always love your first job, right? So from there, access and
Actually, one thing when I saw you from far, what I found was that you were smiling, and I know there was this little thing around your face, a glow on your face, which is sometimes you see the pressure on people's faces, especially in advertising, but I didn't see that at all.
Thank you so much.
Which was good.
Thank you so much. So from there, Nokia, Microsoft, Ola, Medibuddy, and now I'm Group Chief Marketing Officer for Narayana Health.
Wow.
And we are a healthcare brand.
Like Preeti said, you are like the gem.
Those are the guys who made us the gem.
Out of Group M, and I'm sure they're very, very proud of you.
Absolutely, and the same way.
Yeah.
Because now, when I sit with my team, the first thing to do is you think like them.
Yes.
What they did with you.
Yes.
And I feel that it's a chain.
Yes.
And it's overwhelming for me right now. But yes, it's the reality.
Can I share one thing with you?
Yeah.
I also had a one year stint in the client side. So I was
Okay.
GM Media, and thanks to Ashutosh Srivastav, who kind of pushed me into going and joining there.
Okay.
GSK.
Okay.
And we at agency are like the bosses and the kings and the queens. We drive the businesses because that's a core.
Yeah.
Our function, our role, and our capabilities is the core to the agency. So when I went to the client side, obviously brand managers are the ones who kind of drive
Absolutely.
the business, isn't it? So media really becomes a staff function. I hated it. I said, excuse me. And Mindshare used to be my agency. So they used to come to the office to service me, and Asha used to be one of the people who used to kind of work on my business. I said, like, "Mujhe apne saath le chalo." I'll go and work in the agency because I used to just not like it there.
Absolutely. So
what
if I have to think about
experience?
retiring,
Yes.
if I have to think about retiring, I will definitely retire there.
Retired there, yes. Good. So carry on.
So yeah, it's almost 3 years now with Narayana Health. We are a healthcare company which started off as a cardiac first, department first hospital chain. And now we've emerged into not only having a homegrown HIS, we have our insurance now, we have our clinics, diagnostics, subscriptions,
And you are present all over the country?
Yes, 14 cities.
Okay.
We just announced another flagship in Kolkata.
Okay.
In Delhi, we are, of course, in Mayur, we are in Gurgaon, and apart from that, we are almost 20 odd hospitals for us.
Okay. And how's AR kind of really playing a role? But that's a topic that we need to discuss in the AdTech.
Absolutely.
And that's
I
a
think,
conversation everybody's having. Yeah.
I think let's take it a little notch up in terms of not just saying AR or AIs of the world.
Yes.
I say from the outside, when you look at a healthcare industry, you always feel that clinically they've advanced a lot, but in terms of patient serving, they've not. Because when I go to a hospital, I have to wait for a lot.
Yes.
The only thing I can do is, as per the timings, I can go.
Yeah.
I have to make a lot of adjustments. So it's from the outside looks like that this is one thing that is not moving in the industry.
Yeah.
So from there, that's why I called out that we have our own hospital information system. The idea was to start serving the way the patient needs are and try to make that shift happen. Because during a lot of, let's say COVID also, a lot of people got understood and got into the habit of using digital tools in terms of taking. So the first thing that we've done already is it's all digitized.
Yes.
And where we sit right now, and very soon we're going to announce ourselves as the paperless hospital.
Okay.
And there are not many in the world who have ever done it. And it's been a journey. So from last 4 years, we've been working on
Very
it.
progressive, yes.
Okay, so we've got it down from 500 to a patient to almost 50 odd to a
Wow.
patient.
Yeah.
And we're going to very soon announce that it's going to be zero. So that's the first mindset that I'm saying, that digitization
Very
is
differentiated, very innovative. Yes.
was the mindset.
Yes.
that-
And very consumer centric approach. Yeah.
Absolutely.
Yeah.
Not only that, we wanted to make it for our doctors as well. So when you see that a doctor comes from home and then only he or she goes for the rounds for critical care or their IP patients,
Yeah.
our doctors don't need to do that. They can sit at their home on their app. We call it Adi. They can actually do their all ICU rounds.
Oh.
They can see who requires my urgent attention right now.
Okay.
Not till the time I go to the
Hospital. Yes.
So those are certain ideas or thought processes that we had in mind in terms of digitization and making it much more consumer friendly.
Yeah.
So imagine when you talk marketing and we come to our realm, how much pro we will be.
Absolutely.
So from that point of view,
so actually marketing, I was kind of wondering what's the kind of role marketing has in your kind of app, but this is what is it.
yes.
Thinking differently.
Absolutely.
Yes.
So I'll tell you what, if you go back to the business again and try to find out the insight from the business, what needs to be done on the marketing, I think the business works on personalization, right? Your report will not be same to my report,
Yes.
and your treatment line will not be
the
support.
same as yes.
So that means each and every user for me is unique. They're not just
There's no
gonna wear
replication here at all.
M size for everyone.
Yes.
Got it? So from that point of view, if we look at it, what does supports us supports us the best becomes the massive personalization that we can do.
Yes.
So imagine if I can understand what's going on with your body because of those markers,
Yes.
and why can't I tell you that this is what you need to do rather than come up and cut it the OTs?
Yes.
So can I prevent that from happening?
Yeah. And
That's where we are scaling in terms of
you speed up the
personalization.
treatment. I mean, so that's,
Why to make you into a position
Yeah.
that you have to get to a OT?
Yeah.
You don't have to.
so what is the competitive landscape for you?
You see, last 3 years, I must say, post-COVID,
I think one thing
Healthcare
COVID
has
did
become-
was everything all was bad about COVID. One thing it was, it really fast forwarded the digitization of the country.
absolutely
And actually not only
crazy
in the
level.
urban market, but also in the tier 2, tier 3 levels. My
Everywhere.
mom, who was completely technologically very, very handicapped, she also kind of became extremely savvy, being able to do Zoom calls also with.
Wow.
So how it's really fast forward. So that's good.
So yeah, so last 3 years, healthcare has been very, very exciting space to be in. And I'm sure you must be reading the billions coming in into private equity firms coming in into healthcare as well. The industry landscape, there's shortfall. Demand is more, beds are less. Demand is more,
Yes.
surgeons are less. Demand is more, the nurses are less. So to be,
At least one particular industry where the demand is more than supply.
of course, no one is
Yeah,
happy about it.
nobody's happy,
That people are getting failing it. So
Yes.
that's why the shift of us as a brand is saying that I try to prevent
Yes.
that from happening.
And I think the doctors, the practitioners can actually handle many more cases than probably they will if they have to physically go
Yeah.
into each one of them.
Yes. So from that angle, if you then come back to saying that, yeah, what is the role of marketing? I'll say it's demand shaping, not demand creation.
Okay.
So how much you can deliver opportunity to people to consume your product,
Yes.
that's your job.
Yes.
You don't need to tell somebody to fall ill or say, for instance, yaar abhi maza pee lete hain aaj coke pee lete hain. You don't have to do that. What you need to do, there are already people looking out for that kind of solution.
Yeah.
If they are looking at, if you're able to provide that. So that's why a very interesting thing of saying that it's demand shaping. It's not demand creation.
That's a nice word way to put it. Demand shaping than demand creating. Yeah.
Correct. The demand is already there.
Demand's already there.
Yeah.
Great. So which is the agency that you kind of engage with?
So we
like
did
when I met you upstairs, I did say that I'm suddenly kind of seeing that Narayana Health everywhere. What's really happening? What are you guys doing to be able to kind of create this kind of a buzz about the brand?
So thank you for the compliment first
Yes.
of all, and I'll pass on
And
the
this is
compliment
honest.
to the team.
Absolutely, yeah.
I'll definitely pass on it to the team because
Yes.
it's their hard work.
Yes.
So from that point of view, we did a pitch last year, and we went on the InnoSheen. won the pitch.
Hyundai's
Absolutely yes. Absolutely yes. So Shane won. Yes, Santosh. So they are our agency right now. But one thing
why did you give it to Group M, if I may ask? Sorry.
So of course Group M was part of the RFP.
Yes.
All were, and it was to our surprise also. And of course, we will have much more discussion off the camera.
But sorry, I put you on the spot there. But that's okay.
But yeah, of course, they were already there. And
no, it's a fabulous agency. Yeah.
It's a fabulous.
And very digitally savvy. Santosh himself is a digital guy.
Yeah.
I used to work with him at Zero, Optum Area, so I know him since then.
Wow.
Yeah.
So it was, for us also, it was a surprise.
Yes.
But a pleasant one. Because I was in our team where we all were with a clear mindset that it has to be a consolidation.
Yeah.
You can't be going at 3 different agencies for 3 different things.
Yeah, absolutely.
If your consumer is one, then don't give me all of these things that iske liye to mujhe specialist chahiye, iske liye mujhe wo chahiye.
I think that's a very good thought, and that's the way it should be. Then you really actually get the benefit of actually the partnership that you have with the agency. They also committed and invested in your business.
Absolutely. Yes.
The last question from you is that you've been here now on the other side, the marketing side. Now, would ever given a chance, an opportunity, would you go back to an agency?
Like I said, I'll retire there for sure.
Okay.
That is for sure, because every day a new problem. Yes, because you've learned from there. Yeah. The kick that you get when you know this is the idea, if it is executed, it will work out well.
And every day is a new day.
And every day
is a new day. Every day is a new case study to kind of crack.
So I still remember that we used to wait for those emails where we used to get a lot of briefs within the organization saying that this is a new brief.
Yes.
Can somebody come up with ideas? I used to love all that.
Collaboration, sitting together, brainstorming, coming with the solution for the client, going and pitching, presenting,
Pitch itself used to be a fun.
Pitch itself used to be. I know I've done so many pitches in my life.
My God.
I can't imagine going. Frankly speaking, if you ask me, probably I will not go back. I enjoy
so I still love the idea, innovation part of it. That always you're thinking something new.
Yes.
Bread and butter always happens. That's the 90% of the work. But that for that 10%, if you're able to put in your best, that's what keeps you hooked on.
Yes. So thank you so much, Ashish.
Thank you so much for having me.
Ending with a big smile.
Yes.
Thank you.